The November 30th, 2010 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Miss Andrews? Mr. Daniele? Miss Kaylee? Mr. Lightfoot is excused. Dr. Quattro? Mr. Rocco? Chairwoman Draw.
Here. And I know that there are several people signed up for the public forum tonight.
I will call your name, and please come forward to the podium and address the committee. You will have 2 minutes, and only 2 minutes in which to address Human Services this evening. Please conclude when the timer sounds, and thank you for your cooperation. Our first speaker will be Teresa Battisti. Please come forward.
Hello, I'm very happy to be here this evening. My name is Teresa. The last name is Battisti. I am deaf-blind. Formerly, I lived in Ithaca, New York. And Ithaca is a very small town. I was there for 11 years, and it was very difficult for me to be able to get around, specifically because of the services within the town itself. Being deaf and blind, there were a lot of communication difficulties, a lot of issues with transportation. People offered me a seeing eye dog, which would be okay, but I'm also deaf. They offered me a hearing dog, but I'm blind. So there wasn't the services to be able to communicate either with the individuals or with the animals that they were offering me. So what I did was move to Rochester. Once I got here, I was thrilled. It was amazing, the services and the help that I've gotten. I'm independent. I go shopping myself. I've started my own business because of the support services I've gotten. I make jewelry, which is just enriching my life. If I have to go to the emergency room, if I need to see a doctor, I can see them immediately. It's very, very important to have my support service personnel around me and with me. Without them, I wouldn't have a place that I could be myself or I could be independent. So the support service person also is deaf, so it's someone that communicates in my language. And the fact that the support services personnel program is here is exactly why I'm independent and on my own. Thank you.
Thank you.
Our next speaker is Meredith Cullen.
My name is Meredith Cullen. I go by Muffy. I was born and raised here in Rochester, and I've worked as an SSP for 3.5 years. I see that SSP is important for deaf-blind clients, and I personally help deaf-blind people with many things, like shopping, doctor's appointments, going shopping for clothing, and driving around to community events. I realize that SSP is very important for deaf-blind people. Without these support service professionals, deaf-blind people will be isolated and not happy. Who is going to help them? So I'd like to ask you tonight to please continue to support the service providers. Thank you.
Our next speaker will be Sarah McMillan.
So, winter is coming soon. We see the rain outside. And once the rain becomes ice, then we're going to have the black ice. And it's very dangerous, right? Everyone knows that. Imagine being a person who is constantly walking on black ice, who is constantly trying to get through life with those dangers and those instances that could occur. For myself, without an SSP, without a support service person who helps me with doctor's appointments, who gets me to where I need to be and what I need to go, I don't slip on that black ice. I make sure I get and I go where I need to be on time and where I should be. Thank you.
Thank you.
Our next speaker will be Dean DeRusso.
Hello, my name is Dean DeRusso. I'm a deaf systems advocate here in Rochester. I advocate for the deaf community. I've really been focusing on systems issues, and deaf-blind has become a big issue in terms of systems here in Monroe County. Keep in mind that when a deaf-blind person goes into the dark, it's even more difficult for them to see things and to get their bearings. When it comes to going out in the community, navigating even simple things like steps can be difficult, and support is needed, and that support comes in the form of the SSP, the support service professionals, who really help people who are deafblind just get around in the community. So rather than being homebound and isolated, they're able to be out and be integrated in the community. When the budget cuts happened and contracts were cut to CDR, I don't think that anyone really knew that this was going to be an issue. We do have quite a large deaf population here in Rochester, and I'd like to put the CDR issues aside and just see that there's a real need for these people who are here tonight and other people like them in the community, just for folks to be able to get out. So whatever it is that you recommend, we'd like your support. And I want to thank you for your time tonight, just to be able to hear what people have to say about the need in the community. I also have a paper to give out that has more detailed information. So I'd like you to take the opportunity to read that, and please feel free to contact me. I'd be happy to meet with you one-on-one and talk more, give you more information about the issues. But of course, time is short here tonight. But really, the deafblind community has needed this program for a long time, and the program has just broken down too many times. The system has broken down too many times. So we'd like to see a new beginning and something that can continue for the long term. Thank you.
Thank you. Is that it? Is there anyone present who's not signed up to speak that wishes to speak to this committee this time?
Yes, I have not signed up.
Okay. Would you like to come forward, please, and give his name to the clerk? Do you have him?
Hello, my name is Mr. Francis Kimmis. I am a deaf advocate. I've been here 35 years. I work with deafblind individuals as a support service provider in different capacities. I attend Emmanuel Church for the Deaf, just down the street on Genesee Street. The church was very, very, very dark. They appointed me to come and do some remodeling, and I've done that, and it's taken 5.5 years to remodel it to the point that it is now, to add all of the light fixtures, to make it bright, to make it where individuals who are deaf-blind are able to see and enjoy the Word of God. And from that experience, that clearly enhanced my understanding of the need for those individuals who are very lonely, who are not out there, who are very isolated. As the woman said earlier, moving from Ithaca to Rochester. I know other people who have moved from Buffalo to Rochester. And the reason is because of the services that we have here, because these people are not isolated. They're out in the community. I can't picture being isolated myself. I'm from Islip, New York myself, and I felt that isolation. But when I got here to Rochester and I was involved in more information and more activities and things that are happening, I could see that this was the place to live. This was the place that we are supported, we have the services, and we, as Rochester, are known to advocate for our community, and I want us to continue to do that. Thank you.
Thank you. This concludes our public forum. And at this time, we have a presentation of the proposed 2011 Monroe County budget by Susan Walsh, the Director of the Office of Management and Budget. Susan? Welcome. Thank you.
Good evening, and thank you, Chairperson Draw. I'm pleased to present an overview of Monroe County's proposed budget for 2011. I'm particularly proud that in the face of diminishing revenue and growing mandates, the county executive has worked diligently to develop a budget that's balanced, doesn't raise taxes, and preserves services. After this presentation, I'll be available to take questions. I'm first going to look at an overview of the operating budget. Our budget is divided into two component parts. The operating budget, you can see displayed here. Mandated costs in the operating budget increase by $24.6 million, or 3.7%. Non-mandated expenses increased by $900,000, or less than 1% over 2010. Operating debt service decreases by $7.4 million, 10%. Non-mandated user fee supported activities, those include the hospital, the airport, solid waste, and pure waters, decreased by $300,000. The operating budget totals $931.7 million. This is growth of 1.9% over 2010. And when we combine this with the grants budget, the growth is 1.9% over the entire budget. I next want to take a look at expenses as part of this operating budget. The two functional areas of interest to this committee are human services and health services. They comprise the largest portion of the operating budget. Nearly 40% of expenses in our operating budget are spent on these areas. The largest being human services. That consumes 25% of the operating budget, and those expenses are attributable to social services, aging, youth, and veterans programs. Health services comprises about 15% of the operating budget, and those are for mental health, public health, and Monroe Community Hospital. Next, we'll take a look at the revenues that support the operating budget. Most of the revenue comes from property taxes, nearly 40%. And for 2011, the property tax rate remains stable at $8.99 per $1,000 of assessed value. There is some growth here, 0.9%, or about $3 million over last year, and that's due to growth. The second largest revenue stream is state aid of $107 million. Of this, $62 million will be received by the Department of Human Services and $33 million by Public Health. The county's share of sales taxes makes up nearly 9% of the revenue that supports our operating budget, and federal aid provides 8% of the revenue. Of the $77 million anticipated for 2011, DHS will receive the lion's share of federal support, nearly $66 million, to fund public assistance benefits. And the amount represented in the hospital piece of this pie is MCH patient revenues. Next, we'll take a look at the second component of our budget. It's the grants component. This totals $177 million for 2011, which is an increase of $2.9 million, or 1.7%. If we look at expenditures of the grants budget more closely, we'll see that the largest portion, again, is spent on delivering human services to our community. Nearly 68% of the grants budget is spent on human services. Health services is second largest, consuming 20% of the grants budget, and this is for their maternal and child health programs, communicable disease prevention services, and environmental health programs. The third largest area of grant revenue is attributable to public safety, which includes the sheriff's office, the district attorney's office, the public defender, and the public safety department. For 2011, 82% of our total budget is mandated. And when looking more closely at those mandated expenses by functional area, we can see yet again that human services is the largest driver of mandated expenses at nearly 34%. 11.5% of mandated services are health services, which consists of public health and mental health services. Public safety accounts for nearly 18% of mandated expenses, and this is attributable to assigned counsel costs, probation, jail and civil bureaus in the sheriff's office, the district attorney's office, and the public defender's office. The other piece of the pie displayed here is attributable to the county legislature, community development and workforce development in the planning department, child support collections in the law department, the board of elections, the county clerk's office, civil service portion of human resources, and real property tax service in the finance department. Now we'll take a look at mandated services. The largest area of, non-mandated services in the county, 32% is public safety, and that is for 911, Central Police, Mutual Aid Fire Bureau, the Sheriff's Road Patrol, and staff services. Health services is a very close second here for non-mandated expense, and that is primarily due to Monroe Community Hospital. The other piece of this pie consists of the county exec's office, communications department, portions of finance, planning, law, and human resources. I want to now get into some slides that are specific to this committee. The Human Services Committee is focused on the activity of 4 distinct departments within the county: Human Services, the Veterans Service Agency, Public Health, and Monroe Community Hospital. The first department we're going to look at is Human Services. The Department of Human Services includes the following program areas: family assistance and safety net, adolescent care and child welfare, daycare, Medicaid, HEAP, aging, youth, and mental health. Total appropriations for these activities is $388 million for 2011. You can see that expenses increase due to state mandated rate increases in areas such as the juvenile detention facilities and court-ordered psychiatric care, as well as for programs for which we receive some federal and state reimbursements. In addition to rate increases, The state has also reduced some of its reimbursements in several areas, including daycare and preventive services. The good news, however, is that through the efforts of the Department of Human Services and their Commissioner Kelly Reed, we've been able to reduce the foster care caseload and suppress the growth of public assistance in this community. And Commissioner Reed is going to talk more fully about this when I'm finished with this presentation. Next, we'll look at family assistance and safety net. This shows the revenue and expenses for those programs, and those revenues and expenses are driven by caseload projections. For 2011, we project that the family assistance caseload will be 6,550 cases on average per month. Safety net will be 7,300 average cases per month, for a combined total of 13,850 cases per month. This is a growth over last year's budgeted caseload, and this is primarily due to the current economic conditions. In addition to the caseload growth, there is also growth in expense due to the state's increase in the basic grant component of both of these programs. That component is going up 10% each year in July of 2009, 2010, and 2011. That was by state legislation. The state is going to cover the county's portion of that increase through March of 2012. You'll notice here, I believe, that the net county support for family assistance decreases. This is because of a reduction in the J.D. PINS caseload, which enabled us to use more of the federal flexible spending dollars to support the family assistance program. Now we'll take a peek at daycare. Subsidized daycare in this county continues to support those folks who are at or below 165% of the federal poverty level for 2011. There are decreases in appropriations here which are directly related to the loss of stimulus funding and a decrease in the Child Care Block Grant. Net county dollars into our daycare program in this community increased by $100,000 for a total net county support of $8.2 million. Overall, $45 million is expended on daycare services in this community. The number of children anticipated to be served by this program in 2011 is 7,443. This is a decrease of 903 children over 2010. In addition to the children served with that funding, facilitated enrollment is expected to serve approximately 230 children per month in 2011 for a total of 7,673 children on average per month. This slide concerns children placed in all types of foster care, including family foster care, placements in state-run facilities, and non-secure detention. Through the efforts of Project SAVE, the county continues to experience decreases in caseload size. The projected number of children in foster care next year is 754, which is an astonishing reduction of 183 children on average per month. Unfortunately, locally we've made great strides in reducing this caseload. At the same time, the state has increased rates for each day of care in state-run facilities. Over the 2010 budget, those rates have increased 36%. They went from $557 a day to $762 a day. Purchase of services represents contracts with agencies to deliver preventive and diversionary services to avoid placement of children in foster care. Many of these provide counseling services and parenting classes. Also included here are contracts for adult protection, homemaker services, and domestic violence programs. This portion of the budget remains relatively flat. The Office for the Aging coordinates services for our elderly citizens, including home delivery of meals, employment training, financial counseling, and health education. Predominantly, this office is supported by funds provided by the state and passed through to purchase various services. And this budget also remains stable. The Youth Bureau is another division of the Human Services Department, like Office for the Aging, where state funds are used to purchase services. Youth services include those aimed at youth development and delinquency prevention. The increase here in net county support is directly related to a reduction in state aid. The Office of Mental Health is focused on the prevention and treatment of mental illness. The $600,000 increase in net county support is due to court-ordered inpatient psychiatric costs. Primary reasons for these rate increases are they're state mandated and there's longer lengths of stay in these facilities. The total budget for this is $1.3 million in 2011. Next, we'll take a look at the Veterans Service Agency. The objective of this agency is to assist veterans in obtaining all the benefits that are due them through their service to their country. In 2010, the Veterans Service Agency assisted veterans and their dependents in collecting approximately $19 million in benefits. Appropriations increased slightly here due to salary and medical benefit increases, but revenues remain steady, and this office is 100% mandated. We want to talk about public health next. In public health, we see decreases across the board. The difference between the 2010 amended budget and the 2011 proposed budget is largely due to grants, which come in during the year and are approved by this body. 99% of this department's appropriations are mandated. I want to look at a little more closely at the programs that make up public health. The biggest driver of expense in this department is Special Children's Services at $49 million. Next is the communicable disease prevention work that is done through the TB, STD, immunization, and foster care clinics. The $5 million for environmental health services provides for food inspection, food service worker certification, lead paint programs, and new home site inspections. The medical examiner's office conducts death investigations of all suspicious and unattended deaths in the community. Maternal child health includes programs for high-risk pregnant women and first-time mothers. We're going to look a little closer at Special Children's Services since it's such a large driver of this budget. These services include evaluation, speech, and physical therapy, tuition and transportation for children with developmental delays. It's broken into two programs. Early intervention serves children from birth to 3 years of age, and education for children with disability serves children from 3 to 5 years of age. The 2011 budget projects $19.1 million in net county funding to support these programs. This is a reduction of $500,000 in net county support, which really is due to a moderate growth in caseload in this area and a decrease in some of the state established service rates for provision of these services. Lastly, we're going to take a look at the Monroe Community Hospital. Almost 90% of MCH's population is funded through Medicaid. As a result, reductions in state Medicaid reimbursements have a significant impact on revenue here. To address this, MCH has cut over $1.5 million in personnel and contract service costs. For 2011, personnel costs were addressed in two ways. There has been a reduction of 21.25 full-time equivalent positions. In addition to that, in October, an RFP, a request for proposals, was issued to seek out providers of food and laundry services within the hospital, which are projected to save $500,000 in 2011. That concludes my presentation. I would be happy to take questions. Thank you.
The next presentation we'd have tonight is from Commissioner Kelly Reed of the Human Services Department, and she's going to give us a brief update on Project SAVE. So, Commissioner Reed, if you like. I was just looking, I was going to look over.
Good evening, Chairwoman Draw and members of the Legislature. I'm very pleased to be here with you this evening and to give a report on Project SAVE. I hope at the end of this presentation you'll agree with me that we have much to celebrate and much to be proud of with regard to the achievements in Project SAVE. You'll recall that when we began Project SAVE, we postulated that our community's taxpayers have three primary expectations of the Department of Human Services: that we use our resources well, that we stand up for those who cannot stand up for themselves, and that we hold ourselves, our clients, and our contractors accountable for their actions, as well as for the taxpayer dollars that we spend in the Department of Human Services. And we promised you that if we were able to implement Project SAVE, we would deliver on these expectations. Project SAVE has now been operational for 3 years. And I'm here to tell you that we've not only delivered on these expectations, we've fully achieved all of the expectations, and they have been woven into the very fabric of the work of our department. These expectations no longer represent a radical departure from day-to-day practice. They are day-to-day practice, and they play out in how we conduct ourselves and how we conduct our business every day, as you'll see as we go through our presentation tonight. When we asked you to invest in Project SAVE, we made a serious commitment to you as legislators, to Maggie Brooks as our county executive, and to this community. And most importantly, we said that we would promise a redesign in the way we conducted our business that would allow our department to put itself back into fiscal realignment and to improve the way we do business for our consumers, all the while costing less for local taxpayers. We promised specifically that local taxpayers would not experience $13.4 million in extra cost, and we would save that for this community. In our financial assistance division, we said we were committed to appropriately moving our clients through the welfare system promptly and on to their highest level of self-sufficiency. And in our child welfare work, we were committed to improving the safety and well-being of vulnerable children. And when it was not safe to put those children in their homes or keep them in their homes, we were committed to expediting a safe permanency planning process with a sense of urgency. And finally, we committed to the $13.4 million local savings. In these times of economic challenge, when the need for our services far outpaces the resources we have to support them, it's incumbent upon us as public servants to strike the delicate yet absolutely essential balance of meeting the obligation to those who need our services while meeting the need of those who pay for services to the needy, our taxpayers. The work we accomplish and the relationships we've established through Project SAVE are built on compassion, comprehension, and commitment. They are important services, and we've achieved them with high levels of success. In a time of extraordinary financial hardship, when unemployment is skyrocketing and families who have never received public assistance benefits find themselves not only qualifying for those benefits, but also having to accept them, we've reduced our length of stay on public assistance. And we have effectively partnered with our clients in our community to move clients to a healthier place. We've addressed their physical and mental limitations, their substance abuse issues, and we've allowed them to do what they always wanted to do in the first place, to become self-sufficient. How do we help our clients to achieve self-sufficiency? Well, one of the ways is through employment. Deputy Commissioner Bob Franklin has a favorite expression. The way to get a job is to look for a job. So one of the ways that we achieve self-sufficiency is through helping people look for jobs. Although the recession has shown only marginal signs of slowing, the Department of Human Services is placing record numbers of people in jobs. We placed an average of 455 clients per month in employment last year. 455 clients that were on public assistance on average each month went into employment because of the efforts of Project SAVE. We had a record high number of 551 in September. In the 2 years prior to Project SAVE, that number was around 393 clients. In addition, we've diverted several people from our public assistance caseload. Diversion's really essential in this work because these are folks who never make it onto our caseload at all. They've applied for public assistance, but in our interview and in our relationship building through Project SAVE, we've determined that they don't need to be on public assistance. We believe that they never wanted to be, although they felt the need to come in for application. Savings occur in moving people to self-sufficiency faster, and while it's not required that we do so, we remain connected to our clients even after they've been placed in jobs to ensure their success continues well into their employment. For example, in our transitional jobs grant effort, which occurred over the past year, almost 90% of the folks that we placed from public assistance into employment maintained their employment after we stopped subsidizing their employer. The employer was committed enough to them to pay their full salary and continue them on as employees. Some of you may have heard me reference the Price Right story where a gentleman from public assistance was hired at Price Right off our public assistance caseload. Within a month, he became the employee of the month, and he's now a manager at a Price Right store. We also had a contractor who traveled here from another state with the promise of a job that no one delivered on when he got here. He came to apply for public assistance with us, and we asked him what he really wanted to do. He said, I'm a contractor, and I'm a really good contractor. But I came here for a job that both promised employment and tools, and I have no tools. We bought him tools. He's employed as a contractor here in Monroe County. He never went on our public assistance caseload. A second way we've helped clients achieve self-sufficiency is by moving people onto SSI. Why is that important? because some of the people on our public assistance caseload never belonged there in the first place. They are not capable of employment because they have a disability that will not allow them to be employed. Through our work in the Law Department's SSI Advocacy Office and through our DART team, the Disability Assistance Review Team at DHS, we are getting more people approved for SSI the first time through and more people approved in the appeal process. SSI offers those clients a higher monthly income, and it's a more stable and predictable source of income. In addition, it reduces our public assistance caseload, thereby reducing local taxpayer obligations. Through this work, through Project SAVE, we've saved $5.7 million in recovery in recovery through SSI since Project SAVE began 3 years ago. Now let's talk about the temporary assistance caseload. To be honest, we began Project SAVE with the hope of reducing our public assistance caseload. However, as we planned this effort, no one could have predicted the extraordinary recession our country, our state, and our community has endured over the past couple of years. Unemployment rates in the big 6 counties are as follows: Monroe, 7.6%, Erie, 7.5%, Onondaga, 7.3%, Nassau, 6.8%, Suffolk, 7.2%, and Westchester, 6.9%. Now let's talk specifically about Monroe County. With an unemployment rate of 7.6%, Monroe County has held the temporary assistance caseload growth to a 6% increase, while the other large districts have seen double-digit increases. And as you look here, Monroe starts this chart, it goes up to Nassau. It goes from 6.4% to 61.1% in Nassau County. Now, we usually compare ourselves to the upstate counties. Let's start first with Erie and Onondaga. You'll note that our increase is substantially lower than our sister counties, who are at 10% and 38% respectively, Erie, Onondaga. And let me tell you why that's especially important. Because when we compare the number of staff employed by the Department of Social Services in Erie and Onondaga to the staff employed in Monroe County, it's where our success and our efficiency really starts to show up. For instance, Erie has a caseload to staff ratio of 32 cases per full-time equivalent, and Onondaga has 27 cases per full-time equivalent. We have 51 cases per full-time equivalent. Our staff do more with less. That's our commitment. That's what we promised you in Project SAVE, and that's what we're achieving. Let's put the reality of dollars to the caseload. We've talked about Erie and Onondaga. Let's add the third upstate county, Erie, Onondaga, and Westchester County. These 3 upstate counties have averaged a caseload growth of 22%. If Monroe County had experienced an equivalent growth, our public assistance caseload as of August of 2010 would have been 2,044 cases higher than it was. What would that have meant to local taxpayers? It would have meant significant local expense. At an average cost of $640 per month, those 2,044 cases would have cost $1.3 million per month, or $15.7 million per year, and $5.9 million of that would have come home to roost in the form of local taxpayer cost. The Financial Assistance Division in the Department of Human Services has achieved its success within Project SAVE under extraordinary circumstances, facing a daunting economy, but achieving their success nonetheless. The second and equally important commitment we made in Project SAVE was a commitment to our children and families involved in the child welfare system. Our child welfare work has achieved extraordinary success. Very notably, since the implementation of Project SAVE 3 years ago, the number of children in foster care has dropped dramatically, from a monthly average of 959 children when we implemented Project SAVE in 2008 to 600, now you actually have a number that's a little higher, 663, but I found out just before I came here it's 633 children today. Yep, you heard me correctly. More than 300 children have found their way to a safe, secure, permanent home since the start of Project SAVE 3 years ago. And our work in diverting children from the juvenile justice system has also achieved extraordinary results. At the beginning of Project SAVE, 142 children were placed in OCFS facilities at an annual cost of $16.9 million. Today, the number of children cared for in state facilities is 100. That's important not just from a fiscal standpoint. Project SAVE was about dollars. It was also about practice. What you should know about those particular children is we own the responsibility for paying the bill, but we are not able to contribute at all to the treatment plan for the children there. I care as much about the treatment of those children and their success when they leave that facility so that they never go back there again as I do about the finances. Reducing that number saves twice in this community. We are able to impact the trajectory of success for these kids if they're with us and we influence their treatment, and we're able to save taxpayers a lot of money. Our success in reducing foster care placements also resulted in a combined $10.6 million allocation from New York State in our foster care block grant. Between 2009 and 2010, we received the highest incentive grant in New York State, including New York City. We were the best in the state. That's impressive. We're back to where we always should have been, where we belong. We are the best in the state. We brought home incentive dollars because of the success of Project SAVE, and we brought kids home to safety and security and permanency. Another important area of savings in the Child Welfare Division is our work in alternatives to detention. Alternatives to detention are what's best for our young people. They work, and they are quite simply what kids need. With research indicating that youth who enter an OCFS detention facility having a recidivism rate as high as 80% and a placement cost over $650 per day per youth, or $237,000 per youth per year, this has been and this will be a continued area of our focus. Similar to our work in alternatives to detention, our work with youth who have been adjudicated as persons in need of supervision, also known as PINs, is equally critical in this community. These are youth who are often on the precipice of more delinquent behaviors. Successful intervention at this juncture saves money, and it can profoundly change the trajectory for these youth in their long-term, lifetime outcomes. Very notably, since the start of Project SAVE, PINS petitions have dropped 17%. And even more notably, our use of non-secure detention has dropped by over 3,000 bed days. That's 3,000 nights a child spent in a non-secure detention facility since the start of Project SAVE. 3,000 nights when kids didn't have to be away from their own homes, when kids were able to stay home with services that helped realign their decision-making with their own families. That alone saved this community $1 million and provided better service to young people in our community. So my esteemed colleagues, it's time to bring Project SAVE to a close. We've been successful sooner than we expected to be, and with a higher level of savings than we anticipated we would have. And frankly, we achieved this success while facing extraordinary economic odds. First and foremost, the fiscal objective has been achieved. We promised you we would save $13.4 million over 4 years. This is what we actually brought home to local taxpayers. $5.9 million in local share avoidance by holding down the temporary assistance caseload in comparison to our upstate colleagues. $5.7 million in SSI recoveries in the 3-year period we have been operating Project SAVE, and $10.6 million in foster care block grant incentives for reducing the number of children in foster care in Monroe County. It's $22 million in savings. $22 million in savings in 3 years. And finally, let's talk just for a moment about the economic conditions that existed while Project SAVE was in place. When we began Project SAVE, no one could have predicted the onset, the severity, and the longevity of the current economic recession. No one could have predicted the extent to which state officials planned and actually executed expansion of welfare programs while money to afford those programs was not available. And no one could have predicted the utter financial dysfunction that resulted in cost shifts from the state to this county that were $22 million in total. So in addition to the $22.2 million I just outlined for you in savings, without substantial cuts to programming and without having to pass it along to a taxpayer, the Department of Human Services was able to absorb another $20 million in cost shifts sent to us for mandated programs, sent to us by New York State. While circumstances change, and while I'm saying to you tonight, Project SAVE is no longer a project, I want you to know that we consider SAVE a way of doing business. We will always look for ways to be economical. We will always look for ways to be effective. We will always look for ways to be efficient in the way that we deliver services to families, to children, and on behalf of the taxpayers who pay that bill. I am so pleased and so honored to have been on this journey with you. And I am proud beyond description of the Department of Human Services and the staff of the Department of Human Services, and especially the leadership team of the Department of Human Services, most of whom are here tonight. And as we call Project SAVE a success, I hope you'll share in our pride, because it really has been a project that we all worked on together and that we delivered on behalf of our community. Thank you very much.
I'd like to thank Commissioner Reed for that wonderful report from Project SAVE, and also to our Budget Director, Susan Walsh. And at this time, we would take questions from both Susan Walsh, towards Susan Walsh, rather, over the budget, and also for Commissioner Reed regarding Project SAVE. I think they're going to tag team it. Legislator Andrews.
Thank you, and thank you to Director Walsh and to Commissioner Reed for those presentations this evening. I do have a few questions. I'll start with just a couple of questions regarding the Project SAVE presentation, although granted a lot of this is mixed in with the budget. But congratulations certainly on achieving most of the goals that you outlined over the past couple of years for Project SAVE. Actually, you answered most of my questions in your presentation, so that's great. The one goal that you did highlight that admittedly hasn't been achieved because of the economy is reducing the welfare caseload projection. So I was wondering, given that hasn't yet been accomplished, why would we at this point in time feel it necessary to terminate Project SAVE since it has been so successful?
Through you, Madam Chair, I think one of the things that I want to highlight from the presentation is that while we're saying Project SAVE has been a success because we've achieved the savings that we promised and achieved more than the savings we promised,
the practice itself is not going to go away, and we'll continue to chisel away at that temporary assistance caseload and work in particular on moving people to self-sufficiency either through SSI or through diversion or through employment itself. All of those initiatives are things we consider very critical to the work that we do, and actually a full integration. So it's really not, it's no longer a project, it's a practice.
Okay, thank you, and through the chair. Throughout the past couple of years, we've talked about Project SAVE. There have been about 118 FTEs that have been associated with that project in terms of doing this work of actually achieving these goals throughout this time period. And by ending the project tonight, are those 118 people then in jeopardy of not being a part of the Department of Human Services anymore, either in this year's budget or in future years? I mean, what is actually the effect of ending the project?
Through you, Madam Chair, it is not anticipated that any of the staff that were added as a part of Project SAVE will lose their jobs. However, I do want to point out to you that there are people that were laid off in the Department of Human Services as a part of this budget process. We do have, one of the things that we're very committed to is looking at continuous quality improvement and looking at ways that we can address the issues that we have in the department in different and more efficient ways. So over time, I think that you will see that we will be giving our department a critical look for what's necessary and appropriate. We will be continuing to have the staff that we have, and I'll point out again that, as I said in the presentation, although we did add staff for Project SAVE, we did not add staff to be anywhere near the equivalent of our sister counties of Erie and Onondaga. It's still a lower number of staff than we had in the other counties.
Mm-hmm. Thank you. And through you, Madam Chair, I mean, that is one of my concerns in reviewing the budget as well as looking at the Project SAVE numbers, is that a couple years ago, before Project SAVE, the staffing in DHS was at about 876 positions. It then went up to a high of 1,035, I think, as a direct result of adding positions to achieve the goals of Project SAVE. And we're now back down to, within 100 or so of that low, back down to 996.5. So my concern, I know certainly we're in tough economic times, but my concern is that that number will continue to trickle down. And I think that in the past, certainly there's been concerns about the caseloads here being, in this county specifically, being very high for the staff in the department. And so I just wanted to raise those concerns with the staffing. So the layoffs that are occurring this year in your department, are they positions that had been doing the work of Project SAVE?
Through you, Madam Chair, the answer is no.
Okay, thank you. One other question regarding a goal that you discussed in last year's Project SAVE presentation was to expand the recovery connection, I believe it was called, for managing drug and alcohol addicted clients. And I wondered if you could talk to us a little bit about how that has grown or developed during the past year of Project SAVE.
Through you, Madam Chair, I think you're referring to our RED initiative, Rapid Engagement Project. And I'm going to ask that Kathy Plum, who is our Director of the Office of Mental Health, to talk to you about the success we've achieved through that.
Yeah. Through the Chair, it does indicate in your slide from last year, it is called Recovery Connection, but it does say something about connecting drug and alcohol addicted clients with mental illness. So if that's called that other program, I just wasn't familiar with that title. Thank you.
Through the Chair, we didn't necessarily expand the program, but we redirected some of the ways that we use that program to create a collaboration between mental health and financial services to help engage folks who were applying multiple times for social services but not completing the process, They were also not getting into substance abuse treatment or getting stabilized in housing. And so by working together as a team, that we have now, the rapid engagement demonstration, we have an engagement facilitator through the Office of Mental Health and an examiner through social service that work together to assist people in getting the benefits they need to become stabilized in their housing and get into their recovery. And we've been doing that since April, so it's still fairly new, but we have seen definitely an improvement in people's ability to receive services that they need.
Great, thank you very much. And then my last question regarding Project SAVE is regarding the foster care numbers, which seem to have dropped tremendously over the past few years. How are those children doing? I mean, it's great to divert, I guess, and to decrease placements when necessary, but are the kids succeeding in the direction that we're going?
Through the chair, I'm Cindy Lewis, Director of Children and Family Services at DHS. In answer to your question, we have begun, it's a very new initiative to try to track outcomes of some children who are being discharged from care. In general, the rate of recidivism, the re-entry to care following discharge has not increased. So we are at least confident that the increase in discharges from care is not either ill-advised or unfounded, such that the recidivism rate is increasing.
Great, thank you very much.
Any other questions on Project SAVE? Legislator Kaler.
Thank you, Madam Chair. Through the chair, again, this is phenomenal results, and it is very good for all of us. I did have a question when we talked about the slide achieving self-sufficiency through employment, and in the diversion job entries, you basically outlined that there was a $9 an hour or higher salary. Can you speak to the average pay rate of placement of the other clients, the $455 per month into employment? What type of pay rates these folks were actually getting, knowing that even at $9 an hour, that's dangerously close to being able to afford? Not that my expectation is that you're going to deliver on 15 or more, but to get an idea, to put that in perspective, I'd appreciate it.
Diversion jobs are averaging $9 an hour. For all other jobs, it's ranging between $8.50 and $10.50 per hour.
Thank you. And I guess, if I could, through the chair, the diversion job entries at 9 and some actually with the other placement at 10.50, is it safe to assume that some of the diversion jobs were actually people that were laid off during the recession period, and that for all intents and purposes, some of these at $9 an hour, they were probably taking a severe pay cut for the majority? And backing off that, what I hope to hear is some tracking, even at this level, which would be difficult as well, because if we have a number of families that are employed, but employed at a depleted rate, we look forward to, unfortunately, we'll look forward to more issues coming up in the next 12 months to 24 months with households being unable to maintain. So I guess basically I'm encouraged to hear that we're looking forward and looking backwards and seeing what kind of trends we could pick up. But is my assumption correct?
Through the chair, I would caution us against making assumptions about where they came from or what their job was before they came to us. I think it's hard to do that. What I think the obligation of the Department of Human Services is to assist people in achieving the highest level of self-sufficiency they can within the limits of what we have available to them. It's also important to recognize that it's always easier to get a job when you're employed. So even if your employment, and I'll tell you another success story we have of a gentleman who did go into a job that we placed him in at substantially lower than he was used to being paid, and we said, be humble and learn from this. He worked the desk at Taco Bell. And every day a gentleman came in, and one day, the same guy every day, and he waited on him every day. And finally, the gentleman came in and said to him, you know, I thought you were just having a great day one day when you came in here, but this is your pattern. This is who you are, and we need a guy like you working for us. So he went in and received a new job as a manager with this guy's company. So a lot of it is just having a job and getting out there. The other thing is we provide support services. If you are low income, we try to provide as many other types of services as we possibly can to get you to a higher level of self-sufficiency.
Thank you.
Any other questions on Project SAVE? No? Questions for Susan Walsh on the budget? Legislator Andrews?
Thank you, Madam Chair, and through you to the administration. I'm just going to start with a couple of general overview questions of the budget going to your slides tonight. Let's see. On the third page of your handout, the second slide entitled Mandated Expenses by Functional Area, I managed to capture, I think, most of the components of the other category that makes up the $29.5 million approximately. But if I could request, in writing is fine, that the dollar amounts attributed with each of those areas that were listed be provided, that would be great.
Through the chair, we'll be happy to get that to you.
Thank you. And another question from the presentation. On the first actual slide, which is also in the budget, if I look at the budget numbers under 2010, which is the adopted budget, and I compare them to the budget numbers that were under the 2010 proposed budget, and go category by category of the four categories that exist here, the mandated number under the proposed budget was $645.9 million, and under the adopted budget is $656.3 million, which is about a $10 million increase. And similarly, in the non-mandated, the proposed was $100.2 million, and the adopted winds up being $94.7 million. Again, and the same is true with the non-mandated user fee supported category. What accounts for those changes that occur from the proposed to the adopted?
Through the chair, those changes are, when we've taken a look this year at expenses and how they fit into those categories, it was apparent to us that pension benefits and FICA benefits are mandated expenses in the county. So we have categorized those expenses as mandated for 2011 so that there can be a fair comparison to the 2010 budget. We recast the 2010 figures to reflect the same change in 2010. So we took all the pension and FICA expenses for 2010 on this table and also made them mandated. So as you're viewing it, you're seeing an apples-to-apples comparison between 2010 and 2011. Likewise, when examining expenses in this budget, we noted that alternatives to incarceration, that program, we shifted that category to non-mandated. That's a program that was developed in the 90s, and it was developed to reduce the costs of mandated expenses, jail costs. But those programs are not required by state or federal law. So those, again, were categorized as non-mandated for 2011, and the 2010 budget categories reflected in this table were likewise recast.
Thank you.
Legislator Andrews, may I just ask you to address through the chair, please?
Sure.
Thank you.
Thank you. And through Madam Chair. Then, did you then subsequently go back and recast the figures for the 2009 budget in the same manner to make sure that when you compare the 2009 budget to the 2010 budget, that there's no increase above what would be allowed under the Taxpayer Protection Act? Because it seems like there would have to be some sort of consistency.
Through the chair, for the 2010, when we analyzed 2010 and how those numbers compare, we would have recast the 2009 numbers. When you make the comparison of a year-to-year growth, we don't compare 2011 growth to 2009. We compare the growth each year. So last year, if there were any shifting between categories, those numbers were all recast in that table as well. So when you're looking at the 2009-2010 comparison, it's an apples-to-apples comparison.
Thank you. And through you, Madam Chair, I understand what you're saying. I guess my point, though, is my recollection in 2007 when we passed the Taxpayer Protection Act is that the 2008 year was described as a quote base year, so it could be a baseline comparison for subsequent budget years. But if at this point in time we're now going forward and proposing next year's budget and then retroactively making changes to the categories for the prior year's budget or the current year's budget, but then not changing anything for the prior year's budget, that seems to be a problem in my perspective.
Through the chair, the comparison under the Taxpayer Protection Act is for the 12 months preceding the CPI, which is issued within 60 days of the budget being presented to the legislature. So the comparison needs to be made over a one-year period. Each year, things are recast, so we haven't really changed them for 2010, but we've recast them for this table so that when you make the comparison, we're sure that you're comparing the same items in the same categories.
And through you, Madam Chair, wouldn't it be simpler to just not recast them and just live with what you decided to do for the base year in 2008? Because the recasting sort of throws into doubt, why does it need to be recast now? If it was fine for 2008 and fine for 2009 and fine for 2010, but now in 2011 we have to change it, and then we change it back to 2010, that seems to me less clear than just saying, all right, we passed this law in 2007, we're just going to live with how we delineated the categories at that point in time and follow the law according to the 2008 baseline. But that hasn't occurred year to year in my experience in reviewing the different practices that have gone along with the recasting and casting of categories in this budget.
Through the chair, your question to me, I believe, is wouldn't it be easier?
Simpler.
Simpler.
Through the chair.
And I think it would certainly be much more simple for me. However, I think what we have to do is creating a budget is an evolutionary process, and when we take a look at expenditures and we take a look at new laws and we take a look at the way departments operate, and I think to stand still and say this is a static thing and document wouldn't be a good progressive way to work. Pension costs were a big discussion point throughout communities across this state. And through those discussions, various, we talked to various counties, we talked to NISAC, we had an understanding that pension costs are being categorized as mandated expenses. So, the same is true of the Alternatives to Incarceration program. I think as you examine things and you find areas to improve or to make things more accurate, I think that it would be foolish not to do that. So we do try to be progressive and evolve the budget based on current law, current operations, and current understanding.
Thank you. And through the chair, I can appreciate that. I think that the reason this becomes such a point of contention for all of us is because when this law was passed, we were told it was going to be so simple and straightforward. It's just black or white. And nobody wanted, and we requested and proposed some amendments to it to, try to codify that a little bit. But it was just told it would be very straightforward. And yet each year it evolves and proves that it is anything but straightforward. And secondly, I hope that you can understand when I say this that it is possible to have some doubt as to why each year issues or costs get categorized as mandated when they used to be non-mandated. If you look at the very small increases we've had in the consumer price index, which has caused the county to have to limit its spending increases in the non-mandated area. So removing something like pension costs from non-mandated, which in pension costs we all know are skyrocketing right now, so taking that out of the non-mandated category and shifting it to mandated makes it a lot easier to comply with the Taxpayer Protection Act, one could argue. And so I know that this is an ongoing issue, and I'm going to drop it now. My final request is just that if I could receive a full list then of anything that has been recast between the 2010 and the 2011 budget.
Certainly, I did, through the chair, I did provide that information to Legislator Haney already, and I can resend that out to you as well, Legislator Andrews.
Thank you very much.
Is there any other questions?
No, I have
Legislator
I'll go
Keeley?
on to a couple other.
Oh, did you want to count? Did you want to? Thank you, Madam Chair. If I could, through the chair, I wanted to talk a little bit about MCH, and some of the questions had been answered, but I wanted to just get a little bit more clarification on the services, the possible outsourcing of several, well, in this case, it's a couple, of non-patient care functions, food and laundry. So more specifically, are any other areas of non-critical patient care functions being looked at outsourcing? Excuse me.
Through the chair, at this time, we're looking at food service and laundry. As with our mandated, non-mandated discussion, we're always looking for opportunities to save money. So there may be, as we move forward, other appropriate areas to examine and explore. But right now, it's just those two areas.
Thank you. And through the chair, you spoke of 21 full-time positions being eliminated. Could I get the breakdown of those positions, and were they all filled? I think we've seen in the past where a budget line will have positions to fill, but they're not all filled. So were these all filled at the time that they were eliminated, and at what level do these positions fall under? Patient care or non-patient care?
Through the chair, are you talking about the personnel reductions?
Yes.
That are in the budget or that are attributable to this food service and laundry service initiative?
Well, it could be either. It really depends. If through the chair, if we're looking at reducing services by outsourcing in the personnel reduction, is that included in that reduction as a projection, or are the one in the personnel savings, or are these real savings? And were those positions all filled? And what were those positions?
Through the chair, at the hospital, there were 21.25 full-time equivalent positions that were eliminated from the 2011 budget. The positions that we're discussing when we talk about food service and laundry are independent from that. Those positions remain in the budget. There are 92 folks who work in those two areas of the hospital.
Thank you. That was not clarification. That was 92?
92, that's correct, in food service and laundry.
And then back to the 21 full-time positions. Were those positions all filled?
Through the chair, no, they were not all filled.
Thank you. If I may. Also, at MCH, it appears that the revenue for patient revenue is projected as being down from, if I'm correct, from 2009 and 2010. Can I get an idea as to why the projections are lower? Does it have to do with staffing? Is that part of it, or is it just the expectation that, I don't mean to be funny or cute, but are we all healthier?
Through the chair, can we get some clarification on that question again?
I'll try it again. Patient revenue is projected to be down for 2011.
Through the chair.
Through the chair. Page 755. And through the chair, I guess I'm requesting why that projection is made.
Through the chair, that's due to a rate reduction and a reduction in billable bed hold days. So it's a reduction in reimbursements.
Thank you. And that's it for right now. Thank you.
Is there any other questions? Legislator Daniele.
Through you, Madam Chair, I have one question. I noticed under public health, it speaks of an initiative for 2011 to implement a new tanning facility licensing and inspection program pursuant to state law. And I know this is a subject that's come up a couple times. Can you explain what exactly the state law is and how this type of inspection program would affect the county's finances?
Through you, Madam Chair, the new law went into effect several years ago. The state just last year promulgated the changes in the regulations, and we elected to pick up the program. There are some health risks associated with tanning. There are health risks associated with skin cancer, and also exposure to the eyes with ultraviolet radiation can cause damage to the eyes as well. We will pick up the program with the current staff.
The chair, how does the licensing work? I mean, is it similar to a restaurant, or does a facility need to become licensed, and how often are they inspected?
Through you, Madam Chair, I'm going to ask for some help on that.
Thank you.
This is Mr. John Felson, from the Director of the Division of Environmental Health.
Through the chair, Madam. The license fee is for a 2-year period. It's $30 per facility, and there's also a inspection fee for each device up to a maximum of $50 per bed up to a maximum of $1,000.
Thank you. And another question, not having to do with tanning, but under public health, I noticed that one of the initiatives for 2011 is to move towards electronic medical files. And my question on that is, are these files going to be compatible with other major health networks around the county, like Strong Health and other health groups? And secondly, through the chair, are these systems, or I guess how are these systems shared, and what's in place to protect patient confidentiality?
Through you, Madam Chair, what you're talking about is sort of generally called health information exchange. And the way that is rolling out across the country and especially in New York State is that if a facility like our pediatric clinic implements an electronic health record, we do that using the standards that are set by the state and federal government so that health information exchange between facilities can occur. So we will use an electronic health record that meets all those standards, and we should be able to very easily transmit information to other providers. Probably more importantly, we'll be able to receive laboratory reports, x-ray reports, reports from emergency rooms, and so on for our patients that we see. The new HIPAA laws and the laws of New York State define the requirements for confidentiality of patient records. We believe that electronic health records can be even more secure than paper records. I know that this has been an issue in the public, whether electronic health records are safe. But we are abiding by all the standards, and we have great confidence that we won't have a problem with any loss of confidentiality for any of our patients.
Thank you, Doctor.
Any other questions? Legislator Cayley?
Thank you. Through the chair, I neglected to ask a question about the OASIS program that was moved from MCH last year. It is now at Lifetime Care, if I'm remembering correctly. My question more specifically is I don't understand what is our relationship with OASIS at this point, and is it still funded through the county, and is that why the measures are here projected measures are here in 2011?
Through the chair, the OASIS program that used to reside at Monroe Community Hospital was not a county program or a county-funded program. The hospital served as a landlord to that program. There is a different OASIS program that our director of mental health deals with, which is more of a county program or supports county work. So the OASIS program, through the chair, that used to reside at MCH was not a county program. We were only a landlord for that program.
Okay, then through the chair, then the OASIS program that we're talking about in the budget on page 177 with the measurements and an increase from 3,800 to 6,000 is a different program altogether.
Through the chair, yes, that's correct.
Through the chair, is this OASIS program still at MCH?
Through the chair, this OASIS program was never at MCH.
Okay. Oh,
Does that answer your question?
oh.
Does that answer your question?
Well, not the way I was asking it, Madam Chair, but yes, it does answer my question.
Any other questions?
Go.
Legislator Andrews?
Thank you, Madam Chair. Through you also in the hospital area, I noticed in the budget it indicates that MCH will aggressively pursue other sources of revenue such as Medicare Part D, which is projected to generate $2.9 million of revenue for 2011. Through you, can someone explain what is 2.9, first is 2.9 million of revenue budgeted in this 2011 budget, and then secondly, how are we going to achieve that through Medicare Part D?
Through you, Madam Chair, Medicare Part D is in large part a prescription medication coverage benefit for Medicare recipients, and we now, through our pharmacy, bill third-party insurance carriers. I think the number is into the 30s, so providers in the community and across the country that we, for the residents living at MCH, we bill out the medication, those who are eligible for Part D benefits, which are generally those folks over 65. We bill out the cost of their medications that are covered under that program. And yes, $2.9 million is a realistic target, and that is what's included in the 2011 budget.
Thank you. And through the chair, what was the number for 2010 from this?
Through the chair, we're going to have to respond to you later in writing.
Great, thank you. A couple of questions regarding the public assistance caseloads. Reviewing the past few years through the chair of caseloads for both SafetyNet and TANF, the projections that have been included in the budget have been lower than what has been realized. This year, for example, SafetyNet was projected at 7,000, but it's turned out at this point to be 7,310. TANF had projected to be 6,250, but it's actually now 6,495. My question really is, given this, history over the past few years of having projections that turn out to be too low, why do you believe your projections for 2011 are not also too low when in fact they grow? SafetyNet, there's actually a decrease projected for 2011, and in TANF there's just a very slight increase projected.
Through the chair, a budget is projections, and we attempt to do the very best we can based on trends and history and current knowledge, economic conditions to forecast what's going to happen in the coming year. With that said, we've increased the public assistance caseload for family assistance by 300 cases per month for 2011, and done the same, an additional 300 cases per month for SafetyNet. So we have tried to budget conservatively to make sure that we do have enough appropriations in this budget to cover those kinds of caseload increases.
I'm sorry, through the chair, I must not be following this correctly, but haven't you just increased by $300 for SafetyNet for 2010? I mean, you projected 2010 last year. You projected this year to be 7,000, and now we're ending the year at 7,310. And then next year you're projecting 7,300, which is actually a decrease of 10 from where we are right now from 2010. That, I mean, given the trends, history, current knowledge, and economic conditions, I would say it wouldn't make a lot of sense to me.
Through the chair, we don't just look at last year. Our budgeted amount for safety net is 10 cases per month less than where we are currently, and there is fluctuation up and down over the years in those caseloads. For 2009, that would be nearly 300 cases more than was realized in 2009. So we don't just look immediately behind us, but we try to take a longer perspective in formulating a forecast. We are up slightly over where we project to end 2010 for family assistance, and up pretty significantly over the actuals for 2009 for family assistance. So again, we've tried to make sure that there are enough appropriations in this budget to cover those caseloads, and we do believe that that's where we're going to be during 2011.
Thank you. And through the chair, I mean, that really is my concern because as stated, I mean, the caseloads drive the budget here. And I just believe that given what we're seeing in the economy right now and the trends, that these figures will probably be too low at the end of the year, and this is an area where we may be having to spend additional money than what is budgeted for, and that is a concern I certainly have. Regarding the funding for SafetyNet and TANF, you mentioned in your presentation that the state picked up the 10% increase in the basic grant component for 09, 10, and will for 11 as well. Can you tell me for 2010, had the state not picked up that figure, that additional 10%, what would the county share have been?
Through the chair, for 2010, that amount would be $1.6 million, and for 2011, that amount would be $3 million.
Thank you. Through the chair, and I have the same question regarding TANF. Do you have the figures for 2010 and 2011 as well?
Could you please repeat that question?
Sure. Through the chair, it's the same question regarding the TANF costs. If the state hadn't picked up the additional 10% increase, what would the county's cost have been in 2010, 2011?
I thought so. Through the chair, the number that I just gave you was for both programs combined.
Okay. Thank you very much. A couple questions regarding the projection of savings of the $6.7 million in the budget for the reduction of 114.5 FTEs for 2011. My understanding, the budget indicates it's the 55.5 by attrition, 47 have accepted an early retirement, and then there are 12 layoffs. I had, as you probably recall, I had asked for information regarding the early retirement incentive several times throughout the past few months, and I did receive the listing today, thank you, of the titles who accepted that incentive. My recollection, it was asserted when we authorized the county to offer that incentive that the savings from that would be $1 million. So if the savings from that portion of this FTE reduction is $1 million, how do the other 67 positions roughly accumulate or add up to $5.7 million in savings?
Through the chair, we had a greater participation in the early retirement than we anticipated. So we were hoping to achieve $1 million in savings, and we exceeded that amount. So $1 million for the early retirements We exceeded that amount.
Thank you. And through the chair, can you tell me then what is the dollar figure of savings you attribute to the 47 early retirements?
The savings is $3 million, through the chair.
Thank you. And I'm assuming that includes the cost of the incentive. Is that correct?
Through the chair, that's the gross savings.
And what's the net savings through the chair?
Through the chair, that's $1.2 million.
Okay, thank you. And then through the chair, if that's 1.2 million of net savings, then where does the other 67 positions remain? How do they then add up to $5.5 million of savings?
Through the chair, the total savings for the 114.5 positions that equals $6.6 million is gross savings. It's savings of tax dollars to folks throughout this community, because whether it's funded through local tax dollars or it's funded through state and federal dollars, it's all of our tax dollars. So this initiative to cut those positions saves $6.6 million.
Thank you. Through the chair, then how much does it save in net savings if it's 6.7 gross?
Through the chair, $3.3 million.
Thank you. And through the chair, then what dollar figure of net savings is attributed to the 12 layoffs?
Through the chair, $131,000.
And through the chair, the 55.5 positions lost through attrition, what's the savings attributed to them?
$1.9 million through the chair.
Legislator Andrews?
Yes, Madam Chair.
I was just going to ask you, we're really trying to stick to questions regarding the human services portion of the budget tonight. You will have a chance at Ways and Means to ask those questions.
Thank you. I just have a couple other questions in this area because there
Does
is
it relate to human services?
Well, I have a lot more questions regarding human
Okay.
services.
Can
I
I
only
have-
have a couple more regarding staffing issues because, I mean, it is a full budget presentation that we receive. It's, you know, important to ask these questions. I don't want to take
It
up
is.
all night on Ways and Means as well.
One more question? Okay.
Thank you. Through the chair, how many vacant positions were eliminated in the 2011 budget, or is that figure incorporated into the 114.5?
Through the chair, those positions are incorporated in the 114.5.
Okay, and thank you. And through you, could I just request a list of all the vacant positions that were eliminated, as well as any vacant positions that remain at this point in time that were not eliminated?
Through the chair, certainly we can get that to you.
Great, thank you.
Do you have any other questions regarding the human services portion of the budget?
Sure.
Legislator Cayley.
Thank you, Madam Chair. Lost my place, of course. In the through the chair, in the planning for 2011, one of the projects is the Children's Detention Center, which over a year ago we did a tour of the current detention center, and currently I'm just requesting, in writing is fine, an update as to whatever plans have been, well, certainly not finalized, but do we have a timeline on that detention plan?
Through the chair, we can certainly get something to you in writing.
Thank you. And if I may, through the chair, back to the implementation of the tanning facility licensing. I am encouraged, not really to see another state-mandated licensing, but it should pay for itself, certainly. Through the chair, can I ask what the timeline was for this to be finally delivered from the state? as requiring licensing.
Through you, Madam Chair, I wonder if you could repeat the question. I'm not
Okay.
sure that I quite understood.
I'm sorry, it was vague. I could use an example in terms of the state requirements for tattooing, which has been introduced as the possibility back in 2000, who knows when, and since has not ever proceeded any farther than allowing counties to go forward. I guess in a form of reference, I am just inquiring as to what the state's timeline was when this first came into legislative issue and now being finalized and delivered to the counties to act on.
I'll have to get back, through you, Madam Chair, I'll have to get back to you with the exact date that bill passed. The tanning law and the other law that you mentioned were obviously both passed by the state legislature and signed by the governor. The regulations for the tanning law were promulgated by the state health department. Regulations have not yet been promulgated by the state health department for the tattooing law, and so that's why we haven't looked at whether that would be something we would want to implement in Monroe County. But we'll get back to you with the dates that those laws were, exactly when those were passed.
Thank you. And through the chair back.
Questions in the budget.
I'm sorry.
We can stick to questions within this budget, right? The Human Services
Yes.
budget. Thank you.
The in relationship, this is part of it, in relationship to the tanning facility, increasing licensing, it will require work in applying that and the oversight, but of course the licensing does bring in revenue to the county. In that, in looking back at the fee schedule for food service establishments, I am a little bit disappointed. I guess really disappointed that given the letter from the state that it would be appropriate if we made changes to that fee structure, that administration did not take advantage of that at the break of 2010 to 2011 and reduce the fee structure accordingly. Can I ask for, and what I'm asking for then is rationale.
It doesn't have to do with the Human Services budget. I will overrule that, please.
Okay.
Continue. Do you have another question?
Not at this time.
Thank you. Legislator Andrews.
I have a few questions regarding purchase of services contracts. For child preventive and protective contracts, it appears that the appropriation is increasing by about $650 million, or $650,000 by next year to more than $21 million. Could I request a list of all the purchase of service contracts for 2011, please, through the chair?
Through the chair, certainly.
Thank you. Also, last year, through the chair, I asked regarding those contracts, what percentage of them were evidence-based programs? I think the answer was about 20 or 22%. And if I could have that figure as well when you provide the list, that would be great.
Through the chair, certainly, we'll provide that.
Thanks. And I'm looking at the data on page 150 for child protective cases and preventive cases. And again, there are increases in what we're seeing in our community, which we're seeing increased reports of physical abuse, increased reports of maltreatment, increased reports of sexual abuse investigated each year, and this has been occurring for the past few years. And these contracts, this $21 million, is supposed to be, working to reduce these numbers, not increase them. And so my question is, what sort of evaluation is done for the programs that receive funding in this area by the county?
Through you, Madam Chair, let me first clarify. that an increase in the number of reports of child abuse and neglect in the community is not an indication of an increase in the number of cases of child abuse and neglect occurring in the community. That is an indication of a concerned community, certainly, but what we watch is not that number. We're, of course, concerned about it because it does take time to do those investigations. What we watch is the number that actually, after our going out to the homes, are indicated as where there is a concern for abuse and neglect. That's what we pay attention to in those cases. So the programs that we have are not designed to reduce the number of people calling in. They're designed to reduce the number of cases of incidents of abuse and neglect occurring, and we are seeing no increase in those. As for evaluation of our programs, I'll ask that the Director of Children and Family Services, Cindy Lewis, respond to you.
Through you, Madam Chair, let me clarify first, because I think it's a matter of interest perhaps to you, just to note that while the overall number of child protective reports certainly continues to increase, and that's a trend not only in New York State but across the country, the number of reports of physical abuse is actually decreasing, which is also a trend across the country. Sexual abuse and child maltreatment continue to increase, but the physical abuse reports have decreased. Not that we have any scientific explanation for that. In terms of evaluation, every purchased preventive program is required with our input to establish some measures around their performance and outcomes, and they're required on a quarterly basis to report outcomes on those measures. Nonetheless, having said that, I would also say to you that if resources were different for us, it would be best for us if we were able to evaluate not only what are the outcomes achieved for families while they're receiving those preventive services, but what are the longer-term outcomes. That's not something we're resourced to do at this point, though we continue to look at it and try to see if there are ways to develop some of those mechanisms.
Great, thank you for that. It's certainly an area that we, need to continue to work on, as are many areas. But we want to make sure we're implementing the best possible programs, I feel, with the limited dollars that we do have. Are there any significant changes that you can mention offhand? I know I've requested a list, but between the contracts for 2010 and 2011? Through the chair.
Through the chair, what I would say at this point are really two things. One is that we are in the process of evaluating and discussing the allocation for some of the individual programs, so they may change a bit from what you will see on a list of budgeted items. But we have the allocation for our Youth and Family Partnership and Family Access and Connection team have both been decreased significantly. We have added some dollars for our Building Bridges program to assist us in implementing a different way of working with youth going into residential care that will hopefully allow us to decrease the time those youth are in residential care and allow those services to be continued with those youth and families earlier on and continuing once they're back into the community. So those would be the major ones, as well as some funding for the Alternative to Detention program.
Thank you. One program I've paid attention to over the past few years, we've heard a lot about the Nurse Family Partnership program, was funded last year at $1.25 million. Is that continuing as well for 2011?
Yeah, right. Yeah, through the chair, what you will see when you see the list of the POS programs is that it would appear that the nurse-family partnership it has decreased in its dollars. It has not decreased in capacity. The reason for the decrease in the money is because we've been able to secure Medicaid funding to pay for a portion of those services.
Through the chair, then if last year it appeared at 1.25 million, what will it appear at this year in the listing? I mean, how much of a cut
Through
has
the
the
chair,
program
it's
taken?
900 and, hold on one second. 977,000. Let me also refer to Commissioner Reed to say a couple things about new federal dollars for that program.
Through you, Madam Chair, it is important to recognize that we have been approved for the Medicaid reimbursement, and when those dollars do come through, the money available will be reimbursable to us through, I believe it's April of 2009. So it should be a substantial influx of dollars into the program. In addition, my colleagues in the Department of Health have been joining me in conversations with the State Department of Health about Monroe County and its positioning with regard to home visitation programs overall. Our nurse-family partnership program combined with our perinatal home visitation program and our Building Healthy Children program position us significantly for the ability to receive both the TANF dollars that will be made available, I hope, in the upcoming New York State budget, and some of the federal dollars that will come through for home visitation as well. So we do anticipate that additional money will be forthcoming for this program.
Thank you, and through the chair, continuing that conversation, yeah, I've been aware of some of that because we talked about that last year during the budget season and throughout the year in Human Services Committee. And I think my hope had been certainly that those additional revenues wouldn't supplant the funding that this program has annually received at $1.25 million for the past 2 years. They would help supplement that funding, because I think everyone has acknowledged that program is evidence-based, it's got scientific results, it's well-proven, it's successful, it's helping the children, it's helping the families, and it was something that we as a community wanted to grow. And so I'm disappointed certainly to see the cut. Can I ask how that, through the chair, how that decision was made to cut that program and not cut a program perhaps that isn't evidence-based?
Through you, Madam Chair. First of all, it's really important to acknowledge that this is considered one of the absolute primary programs of Monroe County Department of Human Services and the Department of Health. We are wholly and completely committed to this program and to its growth. One of the issues that we face is that New York State put a cap on the COPS dollars, which is the funding through which we initially began to develop this program. They not only put a cap on the dollars, they made a commitment saying that although it was capped, there was enough money to go around to cover all of the programs that the COPS dollars would fund. They made that commitment and then never were able to achieve that commitment. So we carried the program with no cuts to the program, although New York State didn't fund us wholly for their obligation to the program. We are not cutting this program. The reimbursements for this program have been reduced, but this community is wholly and completely committed to the Nurse-Family Partnership Program. And a suggestion that we are cutting the program or that we would not be committed to its growth is completely and wholly incorrect.
Thank you. Through the chair. Okay, I guess on paper, it certainly appears that if it's going down from 1.25 million to 900 and some thousand, it certainly appears to be a cut if it's from reimbursements or whatever. But I'm glad to hear certainly the commitment to the program, because it is a program I know that I support, and I know that you do as well. Also looking on that page of the budget, I noticed a cut in the domestic violence funding, about 15%. Could I, through the chair, ask why those programs are being cut as well?
Through the chair, the adjustment to the domestic violence programs between 2010 and 2011 is not resultant from a cut of services. It's rather an adjustment in our budget to better mirror the expenditures we are actually incurring.
Through the chair, does that mean that in 2010 our expenditures will more mirror 360,000 instead of the 425,000 that's contained in the amended budget?
Through the chair, that's a correct assumption.
Okay.
Any other questions?
Thank you.
Legislator Kaler.
Thank you, Madam Chair. I just have a couple short questions. Back into environmental health, through the chair, the payroll is dropping, and it may have been mentioned before in the presentation, but I don't recall what the reasoning was for the payroll dropping, and if it is dropping through attrition or through loss of staff, what are we losing?
Through the chair, we had 4 early retirements in that division of public health.
Thank you. And would that mean that those positions would be eliminated at this point? Through the chair?
Through the chair, those positions will not be filled. Those positions will be abolished.
Thank you. And one last one. Having had the services of Healthy Home in the city for the last 3 years through the University of Rochester, and then knowing that some of the program was supported by the county over the last year, through the chair, I didn't find it anywhere in here. I do know that, excuse me, let me back up. I'm asking if there is any support in this budget for any healthy home type programming going forward in 2011.
Through you, Madam Chair, you won't find a specific program in the budget that is called the Healthy Home Program, but we have changed the focus in many of our environmental health programs that in the past had been, if you will, categorical. When we would go into a home, we would perhaps just look for one type of problem, like a problem with lead-based paint. We now are transitioning to a more holistic approach, and that is basically the concept of the healthy home. So we have incorporated the concept into many of our programs in the Division of Environmental Health.
Thank you. And then just a follow-up. Would any of those funds be used for training within the neighborhoods? Trainers to train, just to perpetuate the program in its initial form?
Through you, Madam Chair, in one of our grants, the HUD grant, there are some dollars for training for workers that would do lead-based paint abatement, but the concept is really not incorporated. The healthy home, more holistic concept is not incorporated into that training. It's really much more focused on lead-based paint abatement.
Thank you.
Any other? Legislator Andrews.
Thank you, Madam Chair. And through you to the administration, a couple questions regarding daycare. I think I got the projections for 2011 from Director Walsh as she went through them. Am I correct, if I wrote this down, that for 2011 we're projecting 7,433 children to be served through the Child Care Block Grant, and then 230 per month through the Facilitated Enrollment Program for a total of 7,673? Is that accurate?
Through the chair, you're correct that 7,403 children will be served through block grant funding, total funding. In addition to that is the facilitated enrollment number of 230 children.
230, okay. Thank you. And so then what is our projection of number of children we're going to serve for 2010? Is that approximately 8,940, or is that figure adjusted at this point in time?
Through the chair, the projection of children for 2010 that will be served is 8,402.
Thank you. And could I request, last year I got a very handy-dandy little chart, daycare statistics that was broken out by the 5 different programs. Could I request this as well for the 2010 year through the chair?
Through the chair, certainly.
Thank you. So looking at the math here, then unfortunately it does appear that we'll be serving at least 900 fewer children in 2011 than 2010, and I realize that's due to decreased state funding. What is our plan for after March of 2011? Through the chair, we've talked some about before the state funding going through that point in time. What eligibility level does this budget project for the remainder of the year?
Through the chair, as I stated in my presentation, this budget projects an eligibility level of 165% of the federal poverty level.
Thank you. Through the chair, and that's for the entire year.
Through the chair, that's correct.
Great, thank you. And does the budget also incorporate in the increase in the market rate, which I think occurs this year?
Through the chair, yes, it does. There's a market rate, I believe, in October.
Thank you very much. Through the chair, and is the quality differential maintained through the whole year as well?
Through the chair, yes, it is.
And through the chair, is the same parent contribution rate maintained?
Through the chair, yes, it is. 35% of difference between poverty level and income, yes.
Thank you. And then I'm assuming there's obviously no rollover funds at this point in time from 2010. Is that correct?
Through the chair, that's correct.
Okay. It was announced a few months ago through the chair that we had stopped, I believe, accepting new families into facilitated enrollment in order to sustain the program at the lower eligibility, or the 165 eligibility level. How many children or families at this point in time have been declined, or have we turned away as a result of having to make that decision?
Through the chair, we're going to have to get that data for you and provide it to you later.
Thank you very much.
Any other questions?
I do have a few other questions. Thank you.
Okay. Legislator Andrews.
I would ask a question regarding under Special Children's Services, early intervention. Through you, Madam Chair, we have discussed this program extensively the past few years because it's been increasing so dramatically year to year. My recollection is it was up at least $16 million from 2005 to 2009, and so I was really surprised this year to see a projected slight decrease, so leveling out, so to speak, at $49 million. What's happened to our increasing trend? Why would we be projecting a stable level of funding for the early intervention?
Good evening. My name is Mike Deedy. I'm the Division Manager for Maternal Child Health. Through you, Madam Chair, right now we can point to a couple of key circumstances that we are able to recognize the decrease. One, in fund expenses. One is New York State had amended their rate structure. They have new interim rates that were recognized for this year. And the other is that although we're seeing still a slight increase in the number of children referred and those that end up with a plan to receive services, there is less severe need, so meaning multiple services. These are anecdotal at this time. I participate in a statewide council that is reviewing the trends with the new interim rates and regulations, and we're going to determine if these are in fact the trends that are occurring, the factors that are leading to these results, and if they are being recognized statewide.
Thank you very much for that. And through the chair, can you just describe in a little more detail what that means? New York State amended its rate structure. Does that mean we reimburse less or it costs less to provide, or can you just give me some figures, please?
Sure. Through you, Madam Chair, there are various services that are provided through early intervention. Some include home or community-based services, where the therapist would go out to the home or in a community setting. There are evaluations to determine if a child is eligible to receive services. There are facility-based services, where the family would go in, the child receives services, group services, parent-child group, or group developmental. And they amended the rates to decrease the reimbursement for home and community-based, which is the high percentage number of services that are approved, and they substantially increased the group services, which at this time, although the rates are increased, we're not seeing a dramatic increase in those services being authorized or a change.
Great. Thank you for that information. Could I request, just as follow-up, that you, if it's possible, to provide a breakdown of the number of children serviced in each of those different categories that you listed for 2010 and then what you're projecting for 2011?
Through you, Madam Chair, we can get you that information.
Okay. Thank you. Also, through the chair, in the area of maternal and child health services, it looks like the appropriation is decreasing by about $2.3 million. There seems to be a decrease also in the commitment line for agency contracts between 2010 and 2011 of a little over $1 million. Could you explain which contracts are being eliminated?
Through the chair, contracts aren't being eliminated. That's really due to grants that will be appropriated throughout the year.
Okay. Thank you very much. A couple other questions. Let's see. Recently, there was a lot of media attention given to an alarming increase in the number of young people that have been identified HIV positive in our community, and my understanding is that's been happening in other areas as well. I didn't see anything specifically in the budget that addresses this concern directly. I understand that the information perhaps was just came to our knowledge very recently, but I see a decrease in the contractual services in the Communicable Disease Prevention and Control Division, and a decrease in agency contracts, which could just be due to the fact that we receive grants as we go along. But at this point, I would ask through the chair, what is our plan for addressing this alarming increase in the number of young people that have been identified HIV positive?
Madam Chair, I don't think it's really not a budget-related question. It's a program or services-related question.
Can we stick to the human services budget?
I'm sorry, with all due respect, Madam Chair, I mean, there are programs in the budget that directly speak to this. There's an STD control program, there's an AIDS program coordination and education surveillance program, there's HIV surveillance program.
Legislator Andrews, can we just...
I would really love to understand how the funding in this area is going to be used then to combat this alarming increase that Dr. Doniger has spoken to numerous times recently. I think it should be of concern to everybody, and it is budget related. It's right here.
I think just, Madam Chair, I just think because something is a service in the budget doesn't necessarily make it a budget question.
I think if you'd like to talk to Dr. Doniger later about that.
Madam Chair, if we're going to talk about program specifics, that should be related to the Human Services Committee or submitted to Dr. Doniger in writing. But let's stick to the budget tonight.
Absolutely. you have another question?
Yes, well, on this then, through you, Madam Chair, to the administration, what areas of the budget then are directed towards this area to combat HIV in young people in our community?
A specific area?
Yes, what specific programs in the budget then how do we accomplish that goal through our county budget here? What programs do we utilize to combat this uptick in HIV identification in young people?
We're talking about the specific budget this evening.
Yes, I am, Madam Chair. I am respectfully asking somebody who represents the administration to explain to me what in this area of public health and human services, what portions of our budget, what programs in our budget, how much is their allocation for 2011, what are we spending to combat this uptick in HIV identification?
I think we'd let Dr. Doniger get back to you in writing with that information.
Madam Chair, is there a reason why Dr. Doniger couldn't answer my question right now? Isn't this of concern to people?
I think that we'll go to your next question, please.
Well, I look forward to Dr. Doniger's answer in writing. Another question regarding the public health area. And this is new to me. Okay, on page 238, in the objective for the Public Health Department in 2011, it states that the medical examiner's office will be integrated into the new MRC, which is a monitor reaction center, to be constructed. And I would like to ask some information about that center. My understanding is that this perhaps comes from the contract that we entered into with the MC3 LDC. My understanding is that that contract contains some information about a monitor reaction center, but that did not contain any information regarding a backup 911 center. However, the contract between the LDC and the Navitec did mention the monitor reaction center and the backup 911 center. And so I'm just asking at this point in time for some information about this backup 911 center that is mentioned.
Your question, legislator Andrews, is an informational question regarding a budget item?
Yes, it is in the area of public health. It is one of the objectives identified by the Public Health Department for 2011 is to integrate the medical examiner's facilities into the, quote, newly planned monitor reaction center to be co-located at the Ames building. And the best that we could gather is this is coming from the contract between the county and M3S LDC. Is that correct?
Through the chair, the assumption is correct, and what this is effectively doing is that monitor reaction center, if built or co-located at the Ames building, will need to be integrated with the medical examiner's facilities, and that's what this accomplishment is. This objective is trying to accomplish, is the actual merging of the two entities together in one facility.
Thank you. And through the chair, can you also explain then what is the backup 911 center?
Through the chair, specifically, no, I cannot. That's probably better handled by our public safety director, and I would ask you to hold that question until the Ways and Means Committee meeting.
Thank you. I can do that. And I have a further area of questioning. Looking at the budget for under the Human Services Adolescent Care area, the county net support in this area is increasing by about $3 million. And my question would be, what accounts for this increase in net county support?
the chair, can we have some clarification? Are you referring to a specific page in the budget book?
Through the chair, yes, page 167, the Division of Human Service, the Division Adolescent Care.
Through the chair, thank you.
167.
Through the chair, that increase in net county support is attributable to, I discussed it during my presentation, there was a shifting of the federal flexible spending dollars from this area over to support public assistance benefits, family assistance specifically, so that's why we saw that decrease in net county support there. And then in addition to that, there is an increase that I also mentioned in the state facilities, that 36% increase between the 2010 budgeted number and 2011 projection.
Thank you very much. Also, looking in that area in terms of the caseload that's being projected for juvenile detention, if you look on page 150, the new JD placements with OCFS and with DHS are projected to drop for 2011, and it's quite a significant drop actually for the placements with OCFS. What would account for that projected decrease by almost 50%?
Through the chair, there are really two reasons for that decrease. One is an overall effort on the part of the Commissioner of OCFS in New York State to look at placements in OCFS facilities, look for suggesting that they may not produce the best outcomes for young people, so there is some overall thrust in that direction. But the bigger part of the explanation for that is our alternatives to detention work.
Thank you. And through the chair, do we have data then, or do we follow these children to make sure that they're succeeding? I mean, this is a tremendous drop, and so I'm really curious about what happens to these kids.
Through the chair, I can't answer that question with respect to those, the decrease in youth placed in OCFS facilities, because we don't case manage those. But through our ATD work, we will be doing that. That program really got off the ground in March. So we don't have any long-term data yet.
Okay, thank you. Also, as a follow-up, could I receive in writing then a little bit further of an explanation about what the ATD program does for these children?
Through the chair, please.
Through the chair.
Through the chair, certainly.
Thank you. I have another question regarding our Medicaid program. I'm certainly aware of how it's funded, or paid for, rather. My question, though, is if it's possible to get this information. My understanding has always been that, my limited understanding, that Medicaid, that it supports really three different categories: low-income people who need health insurance, members of the blind and disabled community, and then members, or the elderly, who need assisted living, or rather actually just nursing home care. And there's certainly a different level of expense that goes with each of those categories. So my question would be if it's possible to get information through the chair to break down these numbers for our county, so that we can see the number of people who fall under Medicaid and need the health insurance, and then the dollar amount associated with that portion of the program. the number under the received services for the blind and disabled and the dollar amount associated with that program, and then the number of elderly in nursing homes and the dollar amount associated with that program. Is that possible?
Through the chair, with all due respect to the question, I believe the question as asked is virtually impossible to answer. I feel that it's just been way too oversimplified. The number of Medicaid programs in existence certainly is well beyond the 3 categorized in the question. Is probably on the scale of 12 different Medicaid programs. I don't know if we, in any appropriate or realistic fashion, could assemble the numbers or dollar amounts as categorized in the question.
Through the chair, if there is a way that you could get at the information I'm kind of trying to learn, I'm open to your method of breaking it down. I don't know all the different categories, certainly. I'm just interested in seeing where the Medicaid funding goes and how many people receive it for the different components of that program.
Through the chair, the department can certainly give you a breakout of the number of beneficiaries enrolled in the Medicaid program, and I'm sure we could do an adequate job categorizing them to best mirror those categories in the question. I also feel the department and budget could give you a reasonable estimation of the year-to-date expenditures. However, I feel the difficulty arises in matching the categorized dollars of expenditures with the categorized Medicaid beneficiaries.
Okay. All right. Thank you.
Is there any other questions?
At this point in time, I'll submit some further questions in writing and ask some others at the Ways and Means Committee. I don't have anything else right now. Thank you.
Thank you. Again, I want to thank Susan Walsh and Kelly Reed for your presentations to this committee, and I'd also like to thank all the Human Service Department heads that are here tonight that have answered some questions. So thank you again for that. And was it? The next item on the agenda is the approval of the minutes. You have before you the October 26, 2010 minutes. They'll stand approved unless the clerk is notified by any changes by the end of the day. Next item is new business. Madam Clerk.
Referral 10-334.
Moved by Legislator Rocco, seconded by Legislator Quattro. Is there any discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Motion carries. Next item.
Referral 10-335, accept year 2011.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, why is this referral done as a 5-year, as for 5 years?
Thank you, Madam Chair, and through you, it's done in a 5-year time frame to mirror what the New York State OCFS is doing. Last time around, we did 3 years, and that was what New York State OCFS did.
Thank you very much. Through the chair, how does this 5-year period then compare with the contracts that we authorized in the last 3-year period? Are they similar? Through the chair.
Through the chair, these contracts that we're talking about right at the moment are for the municipalities, and those numbers are designated or they're determined based on population of the specific municipalities, and that's state-driven. The only thing that I would say that would be a major difference is between 2000 I think 2008 and 2009, there was a 30% decrease in funding from New York State. So those numbers are actually reflected here, although in 2010 there was a 2.5% increase, and we anticipate that 2.5% increase to be annual for the next 5 years.
Great, thank you very much.
All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-336.
Moved by Legislator Daniele, second by Legislator Rocco. Any discussion? Legislator Cayley.
Thank you, Madam Chair. Just a quick one. Obviously, well, not obviously, doesn't make any difference. Of the contracts that are being cited in here, the agencies, are any of these agencies new?
Through you, Madam Chair, no, they're not. They are pretty much the same as what we did the last cycle. We have partnered with the United Way in their Blueprint for Change in identifying what organizations we want to partner with. There's also a financial question regarding match that each agency has to put up, so we need to make sure that the agency is financially viable. So based upon that match and the United Way's research to look at evidence-based programs, that's how we make those decisions.
Thank you.
All those in favor, please signify by saying aye. Any opposed? Motion carries. Next item.
Referral 10-337, acceptance of a grant.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-338, amend resolution 247.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-339, acceptance of a grant from the New
Moved by
York State.
Legislator Daniele, second by Legislator Rocco. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-340.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-341.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 10-342, authorized.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion? Seeing none, all those in favor signify by saying aye. No opposed. Item carries.
Referral 10-343.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries.
Referral 10-344, authorized.
Moved by Legislator Daniele, second by Legislator Rocco. Any discussion? Seeing none, all those in favor, please signify by saying aye. Any opposed? Item carries. Are there any other items, matters to come before this committee this evening? Seeing none, no further business. The meeting of the November 30th, 2010 Human Services Committee will stand adjourned until Tuesday, January 4th at 6 p.m. Thank you.